So I'd like to welcome everyone to Skye's thesis defense, and I'd like to thank Vern Miller and Brian Jans very much for being readers for Skye, and we're looking forward to whatever helpful feedback that you can provide so that she can make some revisions before finalizing the whole thing. Skye is going to give a brief presentation, an overview of her thesis, and then I'll open it up to each of the readers to make comments, ask questions, and we will go from there. So over to you, Skye.
All right. How does this look shared?
Great.
Amazing.
Yeah, good.
Well, first of all, yes, thank you for the introduction, and thank you, Brian and Vern, and for your patience in receiving my thesis. Stu didn't want me to necessarily say it or said that I didn't need to say it, but this has been a very long process for me. It has taken almost 2 years or maybe a little bit more since really the beginning of exploring what I might choose to talk about for my thesis. And that timeline is actually pretty important to me. I think reflecting back, it has helped me to actually experience my research over the 2 years, as I myself was really experiencing rift in relationship with music throughout the process. So it kind of gave me 2 years of my own experience with this phenomenon that I think has been pretty significant. And it's actually helped to grow and develop my passion for this topic. And I think that that's actually, really relevant to the research. So I have chosen my thesis topic of exploring music therapist experiences of rift in relationship with music. And it came about very organically, which I will share about in a minute. I'd like to just start with going to the rift. This is really the center of, what I was looking to explore and understand. And I've pulled out a few really meaningful and impactful phrases of direct participant language that just really hit me upon hearing, participants share these things. Where's my music? This is who I'm supposed to be, and I know that I need it. And why am I not doing it? I need to find my love for music again. But now I'm like, it brings me back to that time when I played the guitar and sing, and that time was really hard and lonely for me. So I think that might be a part of what's happening. If that, like, I don't want to go there. It was more so, now that you, music, are no longer this partner in my existence, but now you are the reason why I have to figure out how to graduate. Like, you are a task or the thing that I need to understand. Am I less of a musician? And other words used to describe this experience: confusing, painful, necessary, natural, jarring, relieving in some ways, and stressful. And so this just really shows what a significant experience this is for folks. And so we'll explore that today. I came to this research, as I shared, from personal experience. My mother is on this call, so she can really confirm that my entire life has been music. My childhood was music. She spent endless hours driving me to auditions and voice lessons and cheering me on for performances and shows and musical theater, choir, vocal lessons, singing and dancing Barney around the house. and music was my everything. It was how I understood the world. It was the only path I ever saw myself taking in life. It really was who I am, who I was. And so I found music therapy. I came to music therapy where I attended Berklee College of Music and had Brian as my supervisor at Boston Children's Hospital for practicum and other practicums. And music therapy education at Berklee, it was everything I could have ever dreamed of and more. And so I went to school for music therapy, went to Berklee, graduated, did my internship, got my first job as a music therapist. And about 4 years into working as a music therapist, I started to experience what I, kind of described as rift in relationship with music. So I really struggled to connect with music. I really avoided music in a lot of ways. I stopped playing. I stopped singing. I really started to feel very confused, and the experience is still very hard to describe. So I'm really impressed by my participants who were able to describe it so eloquently to me in our interviews. But I started to wonder, is this an experience that other people have been through? Is this unique? I imagined probably no, but I really hoped to learn about the prevalence of this experience of rift in relationship with music, what it looked like for others, how others understood their experience, how they made meaning of their experience. And that is what led me to this research. I remembered reading in Defining Music Therapy by Kenneth Bruscia during Sue's program. I remembered reading about this client music therapist constellation, and it blew my mind a little bit, especially during experience of rift in relationship with music. I thought, as you can see in this chart here that's included in his book, I thought, wow, the personal relationship to music of the therapist is a key part of this constellation that is where therapeutic change occurs. It is right there, but actually, I don't really remember ever speaking so much about that in undergrad. I remembered really hearing pretty consistently that it was important, for us to have a relationship with music, and that's important, but I really didn't remember sitting with it in the same way as it being such a significant piece of this relationship, of this ecology of where therapeutic change occurs. And it's really in literature, music therapy literature, our relationship with music, a positive one, is really positioned as a prerequisite or an assumption, almost an assumption that we are connected to music, that we have this special connection and understanding of music, and that's already established, and that it's ongoing, and that it's assumed. And Bruscia talks about the dimensions of personal relationship with music to include things like the memories that we have with music, the significance that it holds for us, our associations with music, our involvement, the things that we've done in our lives with music, and includes speaking about culture and context as a significant piece of this personal relationship with music. So family relationships, friends, education, all of those places that we are intersecting with music, that has become essential to us building this relationship with music. And I remembered reading about these dimensions, about the music relationship, the personal relationship to music as a part of this ecology, and itself as an ecological relationship, one that is impacted and shaped by all of this context, including our family and friends and education and neighborhood and community and intrapersonal aspects. And this just seemed really foundational for my research. And I came to really feel like it was going to be important to really dig into this piece here. And of course, recognizing, you know, my social location as a researcher, I really knew that my experiences of music, the way I understood music, the way I grew up around music, that was all going to be important to acknowledge at the start of my research so that I could understand where I'm limited in understanding others' experiences of music, because we've, you know, our culture has shaped that. And so I felt like it was going to be really important to acknowledge those things and do a lot of reflection on how my relationship with music came to be and how it might look differently than others, and how my upbringing and culture impacted that. Looking to the literature, I assumed there was probably very little on this topic, but I started with looking at musicians' experiences of their relationship with music, because we are musicians first as music therapists. And so the literature, you know, speaks about music psychology. There's so much in the literature, but I really looked at perfectionism, music anxiety. There's a lot of research on physical ailments that musicians may experience, passion of musicians, motivation of musicians. One really key piece of the literature for me personally, I felt that tied in really nicely with this research, was on passion, and how musicians really experience passion in a unique way, passion for music in a unique way as compared to the rest of the population. And I explored the research on what's called the dualistic model of passion, which essentially describes two types of passion: harmonious passion and obsessive passion. Harmonious passion being a relationship with music, a passion for music that really is centered around one's identity and autonomy for engaging with music. And obsessive passion really being impacted a lot by external factors like pressure to engage with music. They have a hard time stepping away from music, perhaps. And harmonious passion was really shown to improve overall well-being for musicians, whereas obsessive passion was shown to negatively impact overall well-being. And that seemed to be a really key piece of the literature as it related to my research. I explored music therapists and creative arts therapists' relationships with music, as it is found in the literature. I found really one key narrative by Barbara Hesser, and I'll read a short piece of her work that really is centered on the importance of the relationship with music, the personal relationship with music for music therapists. And she says, music therapy is a life committed to the healing power of music. It is the experience of music in our lives and the music of the people with whom we work that is the essence and the heart of music therapy. As clinicians, we have many powerful and deeply moving experiences of sharing music with another human being. However, it is difficult to guide someone on the path of self-exploration in and through music if we are personally unfamiliar with the territory. Only to the extent that we can experience and understand this transformative power in our own lives can we offer it to others in our work. And her writings in this narrative titled "The Transformative Power of Music in Our Lives" really centers the music therapist and the music therapist's relationship with music, whereas a lot of our literature in music therapy centers the therapeutic relationship and the client, and the personal relationship with music of the music therapist is spoken about as it relates to the client and therapeutic relationship, which is true for her work as well. But I really was looking for literature that centered us as music therapists, and the personal relationship with music that we have outside of our profession. Agan, Brusha, Priestley, Robbins, and Robbins also spoke about the importance of our relationship with music, and again, as it relates to our work. Art therapist Patricia B. Allen spoke about, she coined a term called clinification, which essentially is the experience of losing engagement with that creative medium as a result of using that creative medium in our work. So for art therapists, they may no longer engage in art making. And so I found that significant for us as we experience our relationship with music in likely similar ways as art therapists do with their relationship with art. Moving on to burnout in music therapy, there is extensive literature about burnout, especially recently, very recent literature. And one piece of the conversation that's really largely missing from the conversation is burnout as it relates to or is impacted by the music therapist's personal relationship with music. And so I think that that's a really key opportunity. There are a few meaningful connections in the literature between burnout and the musicians, music therapists, musicality, engagement with music, but it's scarce. And then there is a significant gap in the literature regarding this topic of experiences of rift for music therapists. And so I really hope that this can be an introduction to that conversation, that it can invite others to begin to discuss this topic. And I do really feel it is so important and relevant for our profession. Moving on to the theoretical framework and methodology, I'm coming to this work from a constructivist framework, with the belief that reality is constructed in lived experience. And so I did take a narrative approach to this work and really looked to center the personal stories of these participants, and I move forward in the methodology to talk about the shift in methodology that I had over time. So I recruited through Google Forms and was shocked to receive 54 responses to this Google form expressing interest in participating, and 54 music therapists who had identified as having an experience of rift in their relationship with music. And I just knew from that response that this was really timely and important topic. I recruited through use of various music therapy Facebook pages, and selected 8 participants using proportive sampling to really ensure that stories of diverse identities were included and centered in this research, especially given the demographic makeup of our field. And so I came to include 8 participants of diverse sociocultural identities, and feel very pretty satisfied with the diverse participants. So I actually started looking at the data as a thematic analysis and really looking to go through the data, coding it and looking for themes. So I spent, as I shared at the start, a very long time with this data. And I coded it for months. And I used a few different methods of coding. I shifted, the way in which I was coding this data a few times. First looking at it chronologically, also looking at it in different ways, looking at the themes and sub-themes. And so this coding process is actually informed the narrative inquiry that I shifted to, but it was really, I think, important that I went through that process of coding. But I felt, just knowing the data inside and out through prolonged engagement, I just knew that it had really limited it would limit my ability to share the meaningful context and richness of that context in sharing the findings through thematic analysis. And so I shifted to narrative inquiry, and I chose to present the findings and the discussion together in two different types of narratives, informed by that coding process. And I feel that really allowed me to support the validity of the findings that I was presenting, and the trustworthiness. So the first way in which I will share the findings and discussion is through individual narratives of each participant's interview and their experience. And I used the process of member checking, sent the narratives that I had written to each of the participants, requesting their feedback and edits to really ensure that those individual narratives were reflective of their personal experience, and that they resonated with what they wanted to communicate about their experience of Rift in relationship with music. So I'll first share just a few. It's important to me that these 8 participants, but I can't tell their stories in a quick and summarized way. So I'll invite you to read each of their stories, but I wanted to show here the participant makeup, as well as just a sentence about each. Starting with Beck. Beck grew up experiencing music as an escape, and they are no longer working as a music therapist, and they have really come away from playing their instruments that they've played their whole life. That Jade is a songwriter and continues to work in music therapy. Felt really disappointed in herself for the changes that she experienced in her relationship with music. She feels now like it's not so much an ending, but a necessary pause. Eli, he had amazing stories to tell about playing music with his siblings and listening to music at church. He has left music therapy and is working on scheduling in music sessions for himself. Rowan, he was absolutely surrounded by music growing up and has so many incredible stories about connecting with others through music. He is still working as a music therapist, loves music, and is not burned out. So he feels like he's really doing something right. Anjali was known as the girl with the guitar growing up. She has since broken up with performance, but is absolutely thriving in music therapy. Hannah explored music in a carefree way as a child. She experienced a lot of feelings of inadequacy during music therapy undergrad. She has really learned to turn off that voice of inadequacy and continues to work as a music therapist. Ashlyn loved the community aspect of music all of her life. She was in marching band and actually experienced music in a way that she described after becoming a music therapist as abusive. And she's learning to navigate that. And Dora experienced music in negative and positive ways and is no longer in relationship with music today. She does continue to work as a music therapist. And so these stories are told from my voice in my thesis, and have been checked and edited to really reflect these individual stories. And I just felt like telling these individual stories was so important. We needed that, I needed that richness of context to come across, because from, as you can imagine, these 60 to 90-minute interviews, they just had incredible stories to share. And it was really important that the context came through. So I first tell these stories of their individual experiences, and then tell these stories as collective stories that weave in and out of each individual's experiences. And so during that process of coding, I found three main themes to really come through and be communicated through each of these three time frames. The time frames are important because they were the way in which my questions were asked of the participants. So I asked the participants to reflect upon their experiences of relationship with music from the time in which really they were born until they began studying music therapy. So up until really becoming, a music therapy student and engaged in music therapy studies. And then from the time that they began studying music therapy, the time that they were a music therapist, working as a music therapist, up until that relationship changed in terms of experiencing rift. And I will go a little bit more into those experiences in a moment, but these three themes really came across through all three time frames. Participants explored and spoke about the roles that music played, the characteristics of that relationship with music, and internal and external factors that impacted their relationship with music. So I chose then to really look at these time frames as a collective. So beginning with early relationships with music, there were so many incredible stories of how folks came to be in relationship with music for the first time, childhood experiences, experiencing music in middle school, high school, early college years, for some that had not decided to go to music therapy, become a music therapy student in their undergrad. And so music served so many different roles during this time. It served to meet the emotional needs of folks. It served to support emotional regulation and provide emotional release, a distraction for some, meditative time, comfort. It helped folks to shift their mood. It served as a way to affirm the identity of participants. Music at this time was also competitive for some. Some described it as love-hate. Some were forced to engage with music or forced to engage with a musical instrument that they would have not chosen. It was also described as reliable and a constant for many. Music was a facilitator of connection and provided community for so many. It was a huge piece of family culture, and it was significant and formative for participants in understanding their identity and who they were becoming. It provided opportunities for leadership and mastery and proficiency, supporting the development of folks' self-esteem. And it was impacted by many internal and external factors. Those factors included lack of choice, lack of autonomy, competition, external pressures, expectations of others. For some, internal factors included anxiety, stress, self-doubt, lack of interest, and many experienced, even early on, experiences of participating in music in ways that were criticized or judged or analyzed by others, but also incredible experiences of private, intimate engagement, carefree exploration. And so it really, this time period took on a range of experiences for folks. Becoming and being a music therapist, some of the roles that music played during this time were really changing and developing. Folks began to experience music in new ways and form new connections to music. Someone described this time as like music was bigger than me. Folks were engaging in music in new ways, learning new instruments, learning new songs, taking classes in that they had never taken before, really coming to understand music in ways that were expansive and creatively fulfilling. Working as a music therapist for the first time for many was creatively fulfilling and a burst of creativity. It was exciting, innovative, helped to offer confidence for folks. But there were a lot of challenging experiences of challenging and unexpected emotions as music took on new roles. A new level of vulnerability was required of folks. Folks felt imposter syndrome, like they weren't good enough. They weren't a good enough musician. They weren't a good enough music therapist. They weren't a good enough therapist. Some really felt pulled by the priorities of undergraduate studies, the pull of practicing new songs, practicing for competencies, wanting to still engage in the ways that they had previously. Some began to feel like they had to really compartmentalize music. This is the music that I'm doing for fun. This is the music that I'm doing because I have to. They were being graded for the first time for many, and music was becoming demystified. For some, it created feelings of guilt, actually, like I shouldn't be playing this song right now because this isn't the song I'm supposed to be learning right now. I just am having fun playing this song, but that feels really bad because I have other things I should be doing. But it also offered at this time incredible community and they were surrounded by others that had this passion for music as they did. There were significant cultural barriers that are really woven into our profession that were explored. Experiences of music therapy being highly competitive, political, discriminatory. And so that was really challenging for many participants. The experience of rift, which 4 participants experienced for the first time during undergraduate studies, but it really resolved. They then experienced a second after working as a clinician. One participant experiences ongoing rift beginning in undergraduate studies, and that has continued. And then the remaining experienced their first experience of rift after becoming a music therapist during their first few years working as a music therapist. And I really defined it for the purposes of this research as a separation, a breakaway from. It can also be defined as a narrow opening or crack of considerable length and depth, usually occurring from some breaking or parting. So this definition, separation or breakaway from, really resonated for most folks. And talking about this experience of rift, some experienced this rift as oscillating waves coming and going, connection, disconnection, total break. So the ways in which rift was experienced were really different, described differently. And it was really painful for some, confusing. Some described it as necessary, some described it as natural, some as jarring, stressful, and even relieving. Internal and external factors that impacted the rift included societal norms like competition, pressure, these binary understandings of good enough, not good enough, good, bad. COVID had a significant impact for some. Career advancement, life milestones like having a baby, time for engaging with music, discrimination and low pay in the field of music therapy, low energy for engaging with music, fear, dread, internalization of those norms and dominant narratives about music and being good enough, burnout, marginalization. These are all factors that impacted this experience for folks. And other experiences, shared experience included, some felt like they were experiencing just such an saturation of music, exhaustion from music. Some felt like these negative associations that they had were really salient in help leading them to kind of want to step away from or separate from music. A common experience was this feeling of I need to separate myself, and my work, and holding space for these various roles that music plays as a music therapist in our lives was really significant, like really struggling to hold the space for that. Some folks found that they really needed to set boundaries around that. This is my music. I don't bring this into session. I don't play if someone's asking me to play. I play when I want to play. Boundaries like that. Some participants experience permanent changes to their music engagement, some temporary. Some completely broke up with their instrument or completely stopped listening to music. And as I shared previously, one participant no longer has a relationship with music. And so I came into this research with my experiences of rift in relationship with music, and really my understanding of this experience just expanded tremendously. Hearing how others made meaning of this experience for me was really transformative. And I think that it could be really affirming and validating and transformative for other music therapists too. So many music therapists experienced these challenging feelings of guilt or shame for having this experience at all. And that was really salient for myself, but also for many other participants, and something that I think indicates that there's an opportunity in our work in our profession to support these changes and transitions, because change is a given. When we become a music therapist, a music therapy student, we experience tremendous transition. And I feel like this is just such an incredible, there's so much opportunity to support that transition and the changes that music therapists might experience in their relationship with music over time, because that's ongoing. And so maybe some of those challenging feelings themselves would be easier to navigate had we had conversations early in our undergraduate studies about this topic, or it's a topic that comes up in supervision a lot. That could be so helpful. I'm noticing the time and I'm just so running out of time, but I really feel like there's opportunity for us to continue this conversation, this dialogue. And there's so much opportunity for continuing the research, for development of resources for music therapists, for navigating this experience. The limitations of my research included that I was experiencing this rift for myself, and so I may have under-identified with some or over-identified with the experiences of others. But the implications of this research, I think, are huge, that there's opportunity in music therapy education, supervision, for us to support these transitions, to support ongoing exploration and reflexivity. I think that there's cool opportunities for continuing research on this topic in an arts-based way. And I think that there's tremendous opportunity for developing resources for music therapists to navigate this experience. And in conclusion, I feel like as a music therapist, we deserve to give our own personal music relationship with music as much attention as we do the relationship with music of our clients that we support in so many ways. And so I hope that this gives us permission to really talk about our relationship with music and center that sometimes. Thank you.
Thank you, Skye. Do you want to stop sharing your screen now?
Yes.
There you go. All right. So thank you for that presentation. You're obviously very passionate about this now, after all these years of working on it. All these years. But it's good that you still have a passion for it, or that you've regained a passion for it. So at this point, I would love to hand it over to the readers to provide some constructive feedback for you and to ask some questions. So I don't know if there's a preference of who goes first, but would you like to go first, Brian?
Sure. Thank you so much, Sue. Thank you, Skye. First, I'll just make a few comments. Such an important topic, as you pointed out, not discussed enough, not nearly enough. I will admit I've reflected on how I feel like it's discussed a lot more now, probably than.
We lost you, Brian.
Maybe while we're trying to get him back, we'll. Oh, are you back there, Brian?
I think I'm back. Am I back?
Yes.
You're back.
Okay. Sorry about that. So I have a lot of positive comments to make, but in case I freeze up again, Skye, I want to go to a couple of questions that I have. Okay.
Yeah.
Mostly the question that came up for me was around inclusion criteria. And I guess what I'm wondering is, you framed it as those experiencing a rift, right? That's what you asked about. It was anyone experiencing the rift could be a potential participant, right?
Yeah, the language I think that I used in like the recruitment process was anyone who had experienced rift.
Okay, so maybe my question is more like whatever might come next for you around this, because I started thinking about the fact that probably, even if not aware of it, I'm going to guess most music therapists probably, if they really examine their own relationship with music, have, even if they're not, very aware of it or not owning it. But you had 54 responses, so clearly there was a lot of interest in this. And then, so then my next question is, how you went about determining that 8 was the number, and whether you considered, I guess, having a larger number included? Like, how did you narrow it down? I do feel like in your paper, maybe saying a little bit more about your process, you definitely said some things about wanting to be as inclusive as possible, especially including marginalized communities that aren't always included in our research. But could you say a little bit about how you determined that you were going to include those 8?
Yeah, I actually wanted to, I guess the first thought that comes to mind is I was really, as I was interviewing, I was enjoying so much the process of exploring, of exploring this topic, of interviewing folks, of hearing their stories shared. And I actually really wanted to include a much higher number. I did submit for change in procedure with the IRB to actually increase the number from what I had originally. But Sue wouldn't let me do too many because I was really spending so much time with each participant's interview and really like trying to understand the complexities of it. And, it wasn't necessarily in the scope of this study to really like diagnose or like understand what were the causes of rift in relationship with music. Like that actually wasn't, I mean, it came about anyways, but it wasn't my intention to really like make any clear distinctions of this is what caused your relationship or your rift in relationship with music. But there was just so much complexity and so many layers in each person's story and journey that I really felt like 8 was the point in which I needed to like stop because I wanted to do the like each of those stories justice and then look at it in a collective way. But I really felt like I could have kept going. So I kind of just tried to find the number there that would allow me to hear as many different experiences though.
Got it. No, that totally makes sense. Thank you.
And I did, Brian, and maybe I can add this to my paper as well, because I don't think I talked about this, is like I started interviewing while I was still selecting. So that was also kind of what let me know that the number was right, because as I was interviewing, I was feeling like I need a little bit more like of different types of stories, right? So as I started to interview more folks and hear those different types of stories, I felt like, okay, I've reached, enough different types of experiences.
That totally makes sense, Skye. And I think maybe adding a little bit more about that would be really helpful. But that totally makes sense.
I like that.
Thank you.
Thank you.
Vern, did you want to make some comments? We can come back to Brian too if he has more. But do you want to start with something?
Sure. So first of all, well done. Congratulations. And certainly, like, you've said, I think everybody's kind of said, this is definitely a topic that like it's hitting a nerve, like there's a need to talk about this. So well done on kind of locating that and for exploring this. So I have a couple of comments, maybe a couple of questions. So today earlier, I was texting with Sue about something else, and then I was like, "Hey, so I'm in the middle of this, thesis, and something seems, I don't know what the word would be, like it seems different. Maybe is kind of what was going on in my mind." And she's like, "Oh, well, like she wrote it kind of from the perspective of of using her own voice, keeping that common thread throughout." And I was like, "Oh, duh." And then I went back and I was like, "Oh, yep, that's it. And so the way that the paper is written, knowing that makes complete sense. For me, who apparently my thinking can't be flexible enough to pick up on that, could use maybe just a quick statement,
Okay.
So maybe at the beginning, if you, somewhere in there, just kind of say, like, I chose to write this, maintaining my voice throughout in order to better reflect, or, kind of whatever statement you want to make. But I think just something like that for readers such as myself, that would be helpful. Just to go, because it read different than other things that I was reading, and I couldn't quite figure it out. But then that little bit of context situated everything, and everything kind of fell into place and made much more sense for me then.
But that's particularly, Skye, before your lit review, because lit reviews are normally much more in a less personal format than you wrote. And so I was just sort of explaining to Vern that we had agreed that you would do it in that more narrative way. So if you just write something at the beginning that sort of situates that, then people like Vern will be able to cope with it.
Perfect. No, that's what I was about to ask, is like, where does that feel like it needs to happen? So, okay, that's really helpful. Yeah, okay, perfect.
So most of my kind of feedback actually kind of comes from the lit review. In your presentation, you talk about how you kind of thought about your lit review and how you were kind of thinking about the studies that you were looking at. And you mentioned that it was kind of organized around this idea of musicians and their relationship to music. And I don't know, and this is, like, maybe I missed it when I read it, but I don't know that I got that complete sense that you said that in your paper. And I think, again, for readers like me, ultimately that's what this is about. For readers like me,
Yeah.
like having, if you could somehow state in your lit review, maybe at the beginning, like, for me, this all comes from this place of starting with musicians and their relationship to music. And then you're going through, and to me, then that lit review starts to make more sense. Because right now it feels like, here's this, here's this, here's this. But if you say, like, oh, this is about musicians and their relationship to music, then I go like, oh, these are all the different ways that they have that relationship to music. And then you do not need to answer this question now, but maybe just something to think about. And if you have an answer, maybe it's something to throw into the paper. And it's one of the, this is a big one. So please, no pressure to respond now, but just something to think about. All right. So as I read this, I thought to myself, like, as I was reading your lit review, I was thinking about things like performance anxiety, burnout, kind of all these different relationships. Do those things fall under the category of rift? Or is rift something separate than burnout and anxiety? Different than anhedonia or depression? Like, what is, like, are all, or, do you frame those as like all these things are part of rift or different variations of a rift with music? Does that make sense?
Yeah, it does. No, it really does. And I think I already have kind of a sense of how I feel about that. Like, I have kind of thought about rift, and especially from folks' like experiences, as something separate that is impacted by all of those things, potentially, like potentially impacted by anxiety, potentially impacted by somebody's experience of depression, potentially impacted by this obsessive passion, right?
Yeah.
And something that, like, that experience of rift has the potential to further, like, it compound those things too.
Yeah, I love it. And for me, that would tie things together. If you could bring that would, for me, that would chef kiss on the lit review.
The discussion at the end of the discussion, like,
or the discussion, yeah,
or conclusion to the it might be good to bring it back at the end of your narratives to sort of tie it all up, like, from this is what I think, and that's tying it all back from the beginning.
Yeah, so it kind of like how you were just ending and saying like, yeah, that your sense is that it could be related to those things. But for me, then at the beginning in the lit review, maybe talk about how it's different, or how it's, yeah, how it's different than those other things. So help situate you situated yourself in the research, but now situate this idea of rift in relationship to these other things.
Okay.
You know, and it honestly, it could be a paragraph, you know, or a couple of sentences that, you know, do enough to just kind of say like, this is how it's different, and this is maybe how it's alike. I don't know.
No, yeah,
and then,
I really appreciate that.
yeah. And then the last thing, I think the last thing, was I love the constellation, and the way that you wrote about it and the way that it came up in the lit review, you did mention Brucia, and then all of a sudden there's this constellation, and it felt out of place, but it's such a big part of how you're conceptualizing this that for me, I wish that you would maybe spend just a little bit of time talking about that constellation, and maybe being more explicit that of where that comes from. Because it's like you talk about Brucia and then you don't quite draw the constellation to Brucia. It's just like, and then there's this constellation. But, you know, again, a couple of sentences, maybe a paragraph that just says something about that.
And you can listen back to your presentation and maybe bring some of that in there.
Yeah, because that it was such a foundational thing in your thinking, and how you were conceptualizing this rift, you know, and so maybe really tie that idea of rift to that constellation, just as you did in this presentation. I don't know that it came through, at least for me, in the lit review, but so it's like all these pieces are there. It's just kind of like being a little more explicit and connecting some of these dots.
Yeah, I think like one thing that I really struggled with is like I said a few times in like the paper, I really want to center like the music therapist's personal relationship with music, right? But like there's there that is also woven into our work, but I don't want to go so deeply into the work that it pulls away from centering like the music therapist musical self and personal relationship with music. So I tried to kind of like dip my toes into that, but not so deeply that it starts to pull, like all the other literature does, really into like the reason our relationship with music is important is for our work, right? Like I really want it to come through, like the reason our relationship with music is important is for us too, right?
Yeah, absolutely.
So kind of balancing that, I'm even having the same experience that we do as music therapists, like, or at least that I do, and that some of the participants do. I feel like I was having that same experience in the writing a lot, of like really feeling like I have to compartmentalize. And so that's actually interesting too.
And then just thinking about future research, like this is just ripe, you know, like do a phenomenological study on, you know, to really nail that idea of what is rift, you know, and then you can start doing quantitative studies and looking at how many people, you know, and like it just seems like there's a million different directions. So congratulations, really well done, and enjoy your doing more research on this.
Thanks. Appreciate it.
Yeah, research is not my thing. I will say,
but hopefully others will see it and then they'll want to do research on it, because I won't be.
I will say that one of the interesting conversations that Skye and I had towards the end, and it's not really focused on in the thesis, but I think it's a really fascinating aspect of this, is that this idea of it almost became personified, that music was, you know, another entity that someone has a relationship with, and that this
100%.
relationship changes over time, and that some people are able to incorporate those changes, and other times they have real conflicts with it, and setting up like resources such as supervision for people experiencing rift in their relationship with music, where they can have like relationship therapy in their supervision, and that we're not really doing that, and this idea of the clinification of that, of music, and that sort of changing that relationship where it was more of a love relationship, and now it's become a clinical kind of thing, that it's I just think it's a really fascinating thought of setting up these specialized, I don't know whether it be therapy or whether it be supervision or sort of some kind of mix, but I think that's a really fascinating thing to have come out of this too, because some people just, and it's not to say that it's going to fix it, because some people want to end their personal relationship and only use it in work, right? And or they want to leave the profession altogether, and that should all be okay, right? It shouldn't be that they have to come back together again, but to be able to at least work through them and decide, do I want to leave? Do I want to stay? Do I want to find a new way of being in relationship, or do I not? I think
Well, and that was really like significant for my experience, and what like was really transformative for me too, was that I honestly, and I don't say this like so much in my paper because I tried to just like not put too much of my own experience into it in the way that it like took away from other people's experiences, but I came into it absolutely feeling like this is terrible. This is a bad thing that I'm experiencing. This is so, I feel so guilty and ashamed. I have to fix this, right? And this will be the only time I experience it. If I fix it, it'll never happen again, right? And so that was really transformative for me to hear others' experiences of like, any other relationship goes through ups and downs and is connected at some points and disconnected at some points. And if I were to experience resolution from this right now, I still will, you know, in the future have these ongoing transitions and changes that I need to attend to, and that will be challenging to navigate. And maybe I would have more of the tools to. So I really started to understand the experience so differently and be more gentle with myself. And like I still would say that I'm in the experience of rift probably, but navigating it with so much more grace and understanding and patience. For sure. Like I'm being patient with music right now, you know, like me and my partner, we're not always the most connected lately, but I'm being patient with them. I accept them for who they are, and we'll get there.
just clarifying, you meant your partner as in music, right?
Yeah, not my partner on screen.
I was feeling really bad for Jess for that.
Sorry, Jess.
Thanks for the clarification there, Sue.
Brian, I'm so curious if you had any other questions or comments.
Well, Vern touched on a few things that I did have in my notes before I was freezing up again. And I do think, but one thought I also have is I think that some of the literature you did include, I thought was really important to include. And it's not exactly the same as what you're researching, but it does connect so well with it. And that is the Clements Cortez and CUNY Miura articles I thought were really important to include. And then I'll be in that last part of the literature review. I felt like I wondered if it would have made sense to include, if there, I kind of wondered, were there any articles that, you know, almost go in this direction, but not quite, that would almost give you additional evidence of the gap? Like I saw a few things related to exploring professional identity, and there is music as part of that, but it's not exactly a rift. In fact, it's more in a positive way. But it's like, I think some folks have looked at this, but not in the same way that you're looking at it.
Yeah,
And
like
then the other,
yeah, sorry, I'm sorry.
or if it was musicians, but not
Mhm.
music therapists, I'm sure, that also would be interesting to include. I just felt like that last paragraph was a little bit brief.
Okay.
And then I definitely agree with Vern that connecting everything back in the discussion would be really good. As far as that question you're left with, like what came first, symptoms of burnout and depression, all these other things, and that's causing the rift, or is it the other way around? Can helping one help the other? Can the music be part of both? And that's what I think connects well with the Kunimura article and materials and all of that. And I was even starting to wonder whether the Brusha, there are two things I also thought maybe could connect back in the discussion. I haven't really thought this through. It's just coming up as others were sharing. Might be the harmonious passion. Is that
Yeah.
connect back? Because I love that so much that you brought
Me
that up.
too.
Is that the goal? Like connecting back to harmonious passion? Is the Brusha underlying theory part of what you're trying to reconnect with?
Okay.
Those are questions I'm left with, and would that be helpful in some way to put that out there in the discussion? And then, yeah, my last thing was also like Vern's, what's next? Because I think whether you want to or not, Skye, you've opened something up here that if it's not you, others I think are going to jump into this, and I think it would greatly benefit anyone to either do this, either be a participant or do this research.
Yeah, I didn't talk about it in this presentation because I was running out of time so much, but in my thesis, I talk about it a little bit, but maybe I could expand upon it even more. Like participants told me what an incredible experience it was to participate and to reflect on their relationship with music. And just the process of telling that story was so fluid for folks. Like folks were talking about telling stories that they hadn't thought about, for years and years and years. And just the process of really exploring it, I think there could be like arts-based research around that. And I think like there could be more opportunity for researching like what is the impact of experience, like what is the impact of participating in the research on the relationship with music? Like was there a measurable type of impact by participating in that, right?
And one thing that you touch on a little bit, but that I feel like in some ways to me was interesting, was that you, through this, your feelings around music and music therapy have gone through some changes because you were determined to just be done with the field, and now you're not as determined, right? But I think part of that was hearing other people's stories and just sort of understanding that this is okay. This is just part of the process. And so many times in undergraduate programs, we're trying so hard to keep people in terms of attention that we keep telling them all the sunshine stories and how beautiful,
Yes.
our relationships are, and that they'll always be perfect and all of this kind of thing, rather than sort of doing some really, like, this is going to be shitty sometimes, and sometimes you're going to really hate it. And these are some of the things that you can do when things get rough. It's sort of like you need like relationship counseling before you even go on your like forever journey.
Yeah, it's almost like you're supposed to like, right? My therapist always says, like, when you're doing really well is the best time to talk about what happens when you're not doing really well, right? So when we're doing really well and we're so in love at the beginning, is such a good time to talk about what happens when things are challenging, when we don't have a lot of time to practice, or we don't have a lot of time to engage in music the way that we want to, or, it would be like the best time to do that when you're feeling really good and you're not in riff. And I don't really think that it's like, I don't really think it's indicated, but like, what do y'all think about including some of, like, is it necessary to include some of my experiences of like what caused it for me? Like, I kind of just didn't include any of that at all. But for me, like, I was experiencing so many changes and transitions in my personal life. I was seeing really like traumatic and like having moral, what is the word I'm looking for? Moral burnout at work, because I was working in a facility that was treating patients terribly. And it's like the music, we learn music to be this magical thing that has the power to like change everything. And I think it was a real moral injury. Thank you, Mariz. I think it was really hard for me to see that like the patients that I was working with, music was the only thing that they had, right? The only thing that was like helpful for them at the hospital. It was the only thing that wasn't harming them at the hospital. And that felt really hard to be the person like bringing that, but not being able to change all of the systemic issues at the hospital. So I don't include any of that in the thesis, but that is some of the background that I think is really significant for my story too.
So I think to kind of address that, I think like I'm going to go there. That could be a whole other study.
Yeah.
You know, I think to go back and try and add that in now feels.
Yeah.
I mean, it could be done, but it's almost like you would be starting over in some ways, I feel like. But yeah, I think it could be a great study.
I just want to go back a few weeks to when Vern and Skye and I were all in the same, and Mary Rose and Jess, were all in the same building. And Skye was like, there's no way I'm going to get this written and defended before Sue goes to Australia. I leave on Monday. You did it. Thanks. Just needed that little push. Vern was like, you can do it.
I really was like, there's no way. It's absolutely impossible. And it feels pretty cool because today I'm going to get emotional. I went and got my new badge for my PRN therapist and music therapist position at a new hospital. So feels like synchronous timing.
That's amazing, because you had told me you weren't going back.
Yeah, for sure. I don't know if Brian even knows that, or if that your first time learning that I had left music therapy was reading my paper.
No, I think I did know that, but I didn't know about what you just shared. So congratulations on so many levels, Skye.
Thanks, Brian.
So many changes.
Mary Rose.
Mary Rose is making you a little badge saying MMP. So yeah, I'm excited for you. I'm going to turn off the recording and say thank you again to your readers, but I'm just going to turn this on.